Hi, I am Dr. A. Navaladi Shankar, Senior Consultant Orthopedic Surgeon with knee and spine specialist of my interest, practicing in Apollo Hospital for past 25 years. I completed more than 10,000 surgeries in this both knee and spine surgeries field. So coming to the orthopedics, we are talking about the knee. As you all know, knee is the commonest problem the patient present with arthritis. If you talk about recent advances in arthritis knee can be done by the robotic knee replacement, which is a recent advance where the perfect match is given each and every patient so that they walk back normally like a normal knee. That is for the arthritis. And when you talk about the sports injury, the latest, we have younger patient, young arthritic knee. We have younger patient with the sports injury, they have a cartilage injury, they have the ligamentous injury. So when you talk about the ligament injuries, you all know about ligament reconstruction is done everywhere. But something more beyond is the cartilage science. So cartilage is a thin layer around the bone which is helpful for gliding. So whenever there is a cartilage damage, if it is left not treated, it lead to the arthritis. So Apollo Hospital, being the pioneer in treating many disease, find out the cartilage is earlier and we do what is called cartilage transplant. So whenever there is a cartilage injury along with the ligament injury, we take the patient's own cartilage cells and then grow in the lab and then put the own patient cartilages back to them. That means we are giving back the normal knee to the patients so that they don't undergo arthritis or they do not need any artificial replacements. This chapter is completely called Orthobiologics. Orthobiologics is something really a new subject where we are trying to keep your own cells, your own bone, your own cartilage to you. The commonest again post-COVID is avascular necrosis of the femur, where the bone becomes damaged because of the COVID or other steroid induced and patient land up in arthritis and hip replacement. Whereas once we get diagnosed earlier, you may not need a hip replacement. We take your bone marrow, we grow your bone marrow in the lab and we get your bone cells and we get back the bone cells into your hip again so that you get a natural hip. Think about 25 years, 40 years, 30 years, young patients with arthritic hip, they not need a hip replacement, but they can have your own natural hip so that they are able to do all the activities. So this is called Orthobiologics, which is incorporated into the field of orthopedics as a recent advances where most of the damaged tissues can be healed normally. Is the back pain stopping you? Most of the back pain, 80% are only mechanical in nature, whereas the 20% is only pathological. And commonest is the herniated disc. And what you have for the herniated disc here is, latest is called endoscopic spine surgery, is nothing but a keyhole. A small needle goes into your back and then only the damaged herniated disc is removed so that you are back on your foot within a day or two. It is not like old age, big cutting surgeries. Now it has just come to the needle surgeries, which is the recent advances in spine surgeries. So Apollo Hospital, Greens Road, Chennai, I have been practicing for 25 years. What I like the most is I always see that anything recent advances is happening throughout the world. We discuss with our chairman PC Reddy, our Preetha Reddy, vice chairperson, and Sunitha Reddy. They always discuss with us in regular intervals to get to know what is happening latest in the world, and that has to be happening in Apollo hospitals. And then we do all the recent advances of orthopedics treatment which is happening around the world can be happened at Apollo Hospital, Chennai. Secondly, we have a very good ultra-modern theatre which is very much important for the clear surgeries, and we also have a backup support like cardiologists, geriatricians, pulmonologists, physicians. So this gives a comprehensive check, so any type of patients, whether patient is starting from 5 years to even 95 years, 100 years, if the patient have a geriatric fractures, we can comfortably take them for surgery because we have a good support system. We have a good colleagues who can talk with. We can share what has to be done, what is something where we can give best to the patients by discussing among the colleagues. We have inter-cross referrals, we have a discussions. So that gives a really big courage to operate on any sick patients or any patient who has got any comorbidities can be treated comfortably and safely, which is very important so that we get back to the thing normally to the patient. So as an orthopedic surgeon, I always want my patient to live pain-free, and I am passionate about sharing knowledge and recent trends in orthopedics, which Apollo definitely gives us a big platform to tell everything and get the patients in a better way.